When most people think about circulation, energy, and performance, whether that means athletic stamina, sexual vitality, or even just clear mental focus, water is usually not the first thing that comes to mind. We hear about supplements, special teas, or even elaborate cleanses. But one of the simplest, most overlooked, and most powerful tools for supporting your body at every age is the way you hydrate. This might sound surprising, but in my clinic, I often see women who are struggling with vaginal dryness, discomfort during intimacy, or frequent urinary tract infections. I also see men who are worried about their erections, their energy levels, or even just feeling sluggish and foggy throughout the day. And one of the first questions I ask them before we get into complex hormones, before we start advanced testing, is tell me how you're drinking your water. Why? Because hydration is not just about 8 glasses a day. It's about how your body absorbs that water, when you drink it, and how it interacts with your circulation, your hormones, and your pelvic and sexual health. Studies from Harvard and the Mayo Clinic have shown that even mild dehydration, just 2% loss of body fluids, can impair cognitive performance, reduce blood flow, and increase fatigue. And from a urology and gynecology perspective, hydration plays a critical role in everything from bladder function to lubrication to erectile tissue health. Think of it this way: your body is a network of rivers. Blood, lymph, vaginal secretions, semen, urine, all are fluids moving through delicate channels. When those rivers are full and flowing, tissues are nourished, circulation is robust, and waste is cleared. But when the rivers are dry or stagnant, everything slows, energy drops, tissues feel tight or uncomfortable, and performance, whether in the gym, the bedroom, or the workplace, suffers. Here's the good news. Optimizing hydration isn't about gimmicks or rigid rules. It's about small, intentional shifts in how you drink that can transform the way your body uses water. And in today's consultation, I'm going to guide you through 6 science-backed insights into drinking water differently, insights that can boost your circulation, restore your energy, and support both sexual and overall performance. So if you've ever wondered, am I drinking enough? Am I drinking the right way? Could something this simple really make a difference? You're in the right place. One of the most common myths I hear in clinic is that hydration is only about the total number of ounces you drink each day. You've probably heard 8 glasses of water so many times it feels like gospel, but here's the reality: the timing of when you drink can be just as important as the total amount. Let's break this down without judgment, just truth. When you wake up in the morning, your body has gone 6 to 8 hours without water. During that time, you've lost fluids through breathing, sweat, and urine. Even if you don't feel thirsty, your blood volume is slightly reduced, which means your heart has to work harder to circulate oxygen. A study published in the Journal of Clinical Endocrinology and Metabolism found that drinking just 500 milliliters of water first thing in the morning increased metabolic rate by up to 30% within 10 minutes, with effects lasting for about an hour. Think of it like priming a pump. That first glass of water gets your circulation moving, your blood flowing more efficiently, and your brain waking up with oxygen and nutrients. This morning, hydration isn't just about energy. For men, better morning circulation supports stronger erectile function. Erections are fundamentally about blood flow, and your body's ability to deliver blood effectively is improved when you're well hydrated. For women, hydration first thing in the morning helps support vaginal tissue health and lubrication throughout the day. Vaginal tissues are highly vascular, meaning they depend heavily on good blood flow. If that flow is sluggish, dryness and discomfort are more likely. Another critical moment for hydration is before exercise. Studies from the American College of Sports Medicine show that beginning exercise, even mildly dehydrated, just 1% loss of body weight from fluids, reduces endurance, increases fatigue, and slows recovery. Imagine trying to wring out a dry sponge. It's stiff, brittle, and resistant, but soak that same sponge and it becomes supple, flexible, and resilient. Your muscles, your pelvic floor, even your arteries work the same way. They function better when the tissues are hydrated. Now let's talk about nighttime. Many people avoid drinking water in the evening because they're afraid of waking up to urinate. And yes, if you struggle with overactive bladder or prostate enlargement, this can be a valid concern. But here's what I often recommend: hydrate steadily during the day. Taper gently in the last 2 to 3 hours before bed, and add a small glass of water right after brushing your teeth if you've been sweating, if you had alcohol, or if your mouth feels dry. This keeps your blood volume stable while avoiding unnecessary middle of the night bathroom trips. So, what's the takeaway here? Don't just ask how much water you're drinking, pay attention to when. Start the day with a glass or two to jumpstart your circulation and metabolism. Drink a full glass about 30 minutes before exercise and continue sipping steadily throughout activity. Hydrate consistently during the day, then taper gently in the evening while still protecting against overnight dehydration. If this resonates, drop a comment because I guarantee you're not the only one who has wondered, why do I feel so sluggish even though I'm drinking enough? Often it's not the quantity, it's the timing. And remember, your body isn't broken, it's just misunderstood. Sometimes something as simple as when you drink your water can make an enormous difference in how alive, energized, and supported you feel. Another overlooked factor in hydration is temperature. Most people don't think twice about whether they're drinking cold, room temperature, or warm water. But the temperature of the water you drink can subtly shape your body's response, especially your circulation and energy. Let's start with cold water. Many people crave a chilled glass straight from the fridge or with ice, especially in hot weather. Research from the International Journal of Sports Medicine shows that cold water can cool your body core more quickly during exercise, which helps you maintain endurance in heat. Athletes who drank cold water during workouts lasted longer and felt less fatigued than those who drank warm water. Think of it like running a car engine. If the engine is overheating, performance drops. Cold water acts like a coolant, keeping the system running smoothly. But there's a trade-off. Drinking very cold water, especially rapidly, can sometimes cause blood vessels in the stomach to constrict, which may slow digestion. This doesn't mean cold water is harmful, it's simply about context. During or after intense exercise, cold water is an ally. But if you're sipping water during a meal, room temperature or slightly warm water may support digestion more effectively. Warm water has its own benefits. In many cultures, warm or hot water is the default, not ice cold. From a physiological perspective, warm water can relax smooth muscles, including those in the digestive tract and pelvic floor. Some studies from the Journal of Neurogastroenterology and Motility have shown that warm water stimulates intestinal movement, easing constipation and supporting bowel regularity. And when your gut feels balanced, circulation and energy naturally follow. Now let's think about circulation more broadly. For men worried about erectile function, remember, erections depend on relaxed, dilated blood vessels. Drinking warm water isn't a magic cure, but it does encourage vascular relaxation in a gentle, supportive way. For women navigating dryness, warm water and consistent hydration may help maintain tissue elasticity and comfort, especially when paired with estrogen-friendly foods or therapies. One question I hear often is, should I only drink warm water like some traditions recommend? The answer is no, you don't have to commit to just one. Instead, use water temperature as a tool. If you're overheated, exercising, or need a quick refresh, cold water helps. If you're winding down at night, easing digestive discomfort, or supporting circulation gently, warm water may be more effective. Room temperature water is generally the safest all-purpose option if you're not sure. So here's a practical takeaway. Start your morning with room temperature water. It's gentle on the stomach and hydrates quickly. During workouts or in hot weather, go for cold water to maintain stamina. In the evenings, or if you struggle with digestion or pelvic tension, try warm water. Your body gives you cues: thirst, comfort, energy shifts. Pay attention to how different temperatures make you feel and match your choice to the situation. Hydration isn't just about more water, it's about smarter water, aligning timing and temperature with your body's needs. And when you do that, circulation, energy, and performance naturally improve. Here's something I often hear in clinic. Doctor, I drink so much water, but I still feel tired, foggy, or even bloated. Am I doing something wrong? And my answer is usually your body doesn't just need water. It needs the right balance of minerals with that water. Let's break this down. Every cell in your body communicates using tiny electrical charges. Your heart beats, your muscles contract, your pelvic floor engages, your nerves fire, all because of minerals called electrolytes. Sodium, potassium, magnesium, calcium, and chloride are the main ones. These aren't just add-ons. They're the conductors that allow water to move in and out of your cells properly. Think of water like passengers on a train and electrolytes as the tracks. Without tracks, the train can't move in the right direction. If you drink excessive plain water without minerals, you can actually dilute sodium in the blood, a condition called hyponatremia. While rare in healthy adults, even mild imbalances can cause fatigue, headaches, muscle weakness, or frequent urination without true hydration. For circulation, electrolytes are especially important. Potassium helps relax blood vessel walls, lowering blood pressure and improving blood flow. Magnesium supports smooth muscle relaxation, critical for both the heart and the pelvic floor. Sodium, in the right balance, maintains fluid volume, which keeps your blood moving efficiently. Without these, hydration is incomplete. Here's where it connects to energy and performance. A study published in the European Journal of Applied Physiology found that athletes who consumed electrolyte-balanced fluids during endurance events had better stamina and faster recovery than those who drank only plain water. And you don't need to be a marathon runner to benefit. Even daily activities, working long hours, caring for kids, or managing menopause-related hot flashes demand a steady electrolyte balance. Now, what about sexual health? Erections, arousal, lubrication all depend on blood flow and nerve function. Magnesium deficiency, for example, has been linked to higher rates of erectile dysfunction in men, and low potassium can contribute to muscle cramps or pelvic discomfort in women. Supporting mineral balance isn't just about sports, it's about everyday performance, including in the bedroom. So, how do you apply this without turning your kitchen into a chemistry lab? The good news is you don't need expensive electrolyte drinks full of sugar. Here are some simple strategies. Add a pinch of mineral-rich sea salt or Himalayan salt to 1 glass of water daily, especially if you sweat a lot. Eat potassium-rich foods like bananas, avocados, or leafy greens alongside your hydration. Include magnesium sources, nuts, seeds, dark chocolate, or supplements if recommended by your clinician. If you exercise intensely or live in a hot climate, consider a low-sugar electrolyte packet. One key point: balance matters. Too much sodium without enough potassium can raise blood pressure. Too much magnesium too quickly can upset digestion. The goal is gentle, consistent support, not overload. If this kind of science-backed detail resonates with you, subscribe to the channel. This is where we dig into the why behind everyday habits without the gimmicks or shame. Your body isn't broken if water alone hasn't been giving you energy. It simply means your cells need more than how they need the mineral tracks that help hydration actually work. This is something I hear often in clinic. Doctor, I'm scared to drink too much water because I'll have to run to the bathroom all day. Or from men, if I drink more water, won't it make my prostate symptoms worse? And from women, more water seems to make my leakage worse, so I just avoid it. Let's break this down. Without judgment, just truth. Your bladder is like a balloon lined with muscle and sensitive nerves. It fills gradually with urine, and when the nerves send the signal, you feel the urge to go. Healthy hydration helps that balloon stretch and contract normally, but two extremes, too little or too much, can both cause trouble. When you're dehydrated, your urine becomes concentrated. That darker color you see isn't just cosmetic, it's a sign of high waste products like urea and salts irritating the bladder lining. A study from the American Urological Association found that people who habitually drank less fluid had higher rates of urinary tract infections and kidney stones. For women, concentrated urine can also worsen vaginal and vulvar irritation, making dryness or burning more noticeable. On the other hand, overhydration can be just as frustrating. If you're constantly sipping or chugging huge volumes, your bladder may never get a chance to fill properly. Instead, it's sending urgent signals every hour or even every 20 minutes. Over time, this can train your bladder into overactive behavior, essentially lowering its threshold for urgency. For men with enlarged prostates, frequent bathroom trips can feel even more disruptive. Here's where the pelvic floor comes in. Think of your pelvic floor like a hammock that supports your bladder, urethra, vagina, and rectum. If you're underhydrated, your urine becomes more irritating, and your pelvic floor may tense up defensively, which can create pelvic pain or even worsen leakage. If you're overhydrated, your pelvic floor may fatigue from constant activation, like a muscle being asked to do too many reps all day. So what's the balance? For most adults, 2 to 2.5 liters of fluid a day, including water, tea, soups, and juicy fruits, is plenty. But it's not just about volume, it's about distribution. Aim to drink steadily throughout the day rather than flooding your bladder all at once. A good marker is pale yellow urine, neither dark amber nor totally clear. Here are 2 actionable tips I share with patients. Space your hydration, divide your daily intake into small, steady amounts every 2-3 hours. Practice bladder training if urgency is an issue. When you feel the urge but your bladder isn't full, try delaying for 5 minutes, then gradually longer. Over time, this retrains the bladder's sensitivity. And for women navigating perimenopause or menopause, remember that estrogen decline can thin both bladder and vaginal tissues, making them more reactive. Hydration helps, but pairing it with pelvic floor therapy or localized estrogen when appropriate can dramatically improve comfort. So if you've ever thought, water makes my bladder worse, know this: your body isn't broken. It's just that hydration, bladder health, and pelvic floor function are tightly linked. By finding the right rhythm, not too little, not too much, you can protect your bladder, support your pelvic floor, and feel more in control of your body. One of the most fascinating and often overlooked aspects of hydration is how it interacts with your hormones. We often separate these things, thinking of hormones as chemical messengers and water as just a neutral background. But the truth is, your endocrine system relies heavily on hydration to function smoothly. Let's start with cortisol, your main stress hormone. When you're dehydrated, even by as little as 1-2%, your body perceives it as a stressor. Studies from the Journal of Nutrition have shown that dehydration increases cortisol levels, which can make you feel anxious, irritable, or wired, but tired. High cortisol also narrows blood vessels, reducing circulation, including to the brain, the heart, and the pelvic organs. So sometimes what feels like stress or burnout may partly be your body's way of saying, I need water. Now, think about sex hormones. For women, estrogen is like an internal moisturizer. It plumps the vaginal walls, improves blood supply, and maintains natural lubrication. But hydration is the delivery system. Without enough circulating fluid, estrogen's effects are muted. Vaginal dryness, discomfort, or recurrent urinary tract infections often worsen when hydration is low. This is why I often tell my patients, estrogen is the messenger, but water is the carrier. For men, testosterone supports erectile tissue health, semen production, and libido. But erections are hydraulics. They depend on water and blood volume. If you're dehydrated, your blood is thicker, your volume is lower, and your vascular system works harder to deliver the same effect. A study published in the British Journal of Urology International highlighted that men with better hydration markers had stronger erectile performance, independent of age. Testosterone can send the signal for desire, but hydration determines whether the body can follow through with performance. Here's another layer: thyroid hormones, which regulate metabolism. Dehydration slows cellular activity, meaning even normal thyroid function can feel sluggish. On the flip side, hydration helps transport these hormones efficiently to tissues. That's why some people notice their energy and temperature regulation improve simply by optimizing their fluid intake. So, what can you do to support hormone balance with hydration? Here are 3 practical steps. Pair hydration with meals. This supports hormone transport during digestion when nutrients and hormones enter the bloodstream. Don't skip electrolytes. Minerals like magnesium and potassium support adrenal function, helping regulate cortisol and stress resilience. Protect hydration during transitions. Women in perimenopause and menopause, and men after age 50, often face shifts in hormones. Staying consistently hydrated can reduce hot flashes, fatigue, and erectile challenges. And here's a reflection for you. Have you ever noticed how stress, low energy, or intimacy struggles sometimes come in clusters? Part of that may be hormonal, but part of it may simply be hydration acting as the quiet foundation behind your hormones. Your body isn't broken if you're struggling with dryness, fatigue, or performance dips. It's just that your hormones can only do their job if water is there to help carry the message. Hydration is not a magic fix for everything, but it is the baseline that makes all other hormone support strategies more effective. As we age, one of the most important changes in our bodies is the gradual stiffening of blood vessels. Arteries that were once flexible become less elastic, which raises blood pressure, reduces circulation, and increases the risk of heart disease, stroke, and erectile dysfunction. For women, the same vascular change can mean poorer vaginal blood flow, reduced natural lubrication, and more discomfort during intimacy. Now, here's the key connection. Hydration helps preserve vascular health. Blood is about half water, and when you're well hydrated, it flows more easily, carrying oxygen and nutrients to tissues while removing waste. When you're dehydrated, blood becomes thicker, harder to pump, and more taxing on the heart. A study published in the European Heart Journal found that adults with consistently low fluid intake had higher risks of developing chronic cardiovascular problems over time. Think of your arteries like flexible garden hoses. When they're hydrated and supple, water flows smoothly. But when they dry out, they harden and crack, and pressure builds. Hydration keeps those hoses more resilient, protecting against the wear and tear of aging. Here's something many people don't realize. Our natural sense of thirst declines with age. That means older adults are more likely to become dehydrated without even knowing it. This can lead not only to dizziness, falls, and urinary tract infections, but also to subtle changes in cognition. In fact, research from the National Institute on Aging suggests that even mild dehydration in older adults is linked to poorer memory and attention. From a sexual health perspective, vascular aging is a big reason why both men and women notice changes after 50. Erections, arousal, and orgasm all rely on quick, robust blood flow. Vaginal and clitoral tissues, like penile tissues, are essentially vascular sponges. They need fluid and circulation to swell, lubricate, and respond. Hydration is not the entire solution, but it's a foundational piece that keeps these tissues functioning more like their younger selves. So what can you do to protect vascular health through hydration as you age? Build hydration into your routine. Don't wait for thirst. Keep a glass by your bed, at your desk, and in your car. Pair hydration with movement. Walking or stretching after drinking helps circulation carry fluid where it's needed. Support hydration with foods. Water-rich fruits, vegetables, and soups count, and also add antioxidants that fight vascular aging. And here's a simple mindset shift. Don't think of drinking water as just quenching thirst. Think of it as daily vascular care, an investment in your arteries, your brain, your heart, and yes, your sexual vitality. Your body isn't broken if you're noticing changes in performance or energy as you age. Aging is natural, but hydration is one of the most powerful, low-cost, side effect-free tools you have to slow vascular decline and keep circulation strong for decades to come. We've covered a lot of ground today, more than most people ever realize when they think about something as simple as drinking water. And that's the point. Hydration is not just about quenching thirst. It's a quiet but powerful foundation for circulation, hormonal balance, bladder function, pelvic health, and sexual vitality. Let's take a moment to recap the truths we've explored together. We began by looking at timing, understanding that when you drink is just as important as how much. Starting your day with water primes your circulation, fuels your brain, and sets the stage for better energy. Hydrating before exercise improves stamina, and steady hydration through the day protects both bladder health and performance. Then we examine temperature. Cold water is excellent for cooling the body and maintaining endurance, while warm water can soothe digestion and support vascular relaxation. Room temperature often serves as the safest, most versatile choice. Next, we explored minerals and electrolytes. Plain water is good, but water with balanced minerals is transformative. Sodium, potassium, magnesium, and calcium ensure hydration reaches your cells, muscles, and nerves effectively. Without them, fatigue and performance dips can creep in, even if you're drinking plenty. From there, we moved into bladder and pelvic floor health. Both dehydration and overhydration can irritate the bladder and strain the pelvic floor. Finding the middle ground, steady, mindful hydration supports control, comfort, and confidence. We also talked about hormones. Hydration interacts with cortisol, estrogen, testosterone, and thyroid hormones, shaping everything from stress resilience to sexual vitality. Water doesn't replace hormone therapy or medical care, but it creates the conditions where your body's messages can be carried clearly. And finally, we addressed aging and circulation. Vascular stiffness and declining thirst make hydration more critical with every decade. Supporting your arteries with daily fluids is one of the simplest ways to slow aging's impact on the heart, brain, and sexual function. Here's the big takeaway. Your body isn't broken if you're struggling with dryness, fatigue, urgency, or performance dips. More often than not, it's just misunderstood. Hydration may not be glamorous or trendy, but it is foundational. When you optimize it, not just the amount, but the timing, temperature, mineral balance, and rhythm, you give your body the conditions it needs to thrive. So here's one small but powerful action I want you to try starting tomorrow morning. Keep a glass of room temperature water at your bedside. When you wake up, before coffee, before checking your phone, drink it slowly and steadily. Notice how your body feels within the next 15 to 20 minutes. Your energy, your clarity, even your mood. That simple ritual can ripple through your circulation, hormones, and performance for the rest of the day. Stay curious, stay informed, and know that your body is worthy of care. If this conversation has helped you see hydration differently, like this video and subscribe. That way, you'll always have access to grounded, judgment-free education on women's and men's health. Remember, you deserve truth, not shame. And sometimes truth is as simple and profound as learning how to drink water in a way that truly supports the life you want to live.